Hello everyone and welcome back to the channel. Today we're diving into a very important topic that affects people of all ages, nephrotic syndrome. Maybe you've heard the term before but you're not quite sure what it means. Or maybe you're a student, a nurse, or just curious about the human body. Either way, by the end of this video you will not only understand what nephrotic syndrome is, but also what causes it, how it affects the body, how it is treated, and how to care for someone who has it. Let's get started. Nephrotic syndrome, also called nephrosis, is a kidney disorder that causes your body to pass too much protein in your urine. Now, don't mix this up with nephritis, which involves inflammation and blood in urine. Nephrotic syndrome is more about leaking protein and swelling, or what we call edema. To break it down simply, here's what happens in nephrotic syndrome. There is a big increase in protein, which is found in urine. There is also a drop in albumin in your blood. There is swelling, usually around the eyes, ankles, and legs, and the cholesterol levels shoot up. Okay, that's why people with this condition often look puffy or bloated, because their blood doesn't have enough protein to hold fluid in the blood vessels, so it leaks out into tissues. Okay, so what causes it? There are two main causes. There is primary, that means it starts in the kidneys. There is also secondary, which means it's due to another disease affecting the kidney. Let's start with primary causes. So we have membranous nephropathy, focal segmental glomerulosclerosis, and minimal change disease, especially in kids. That's why it is common. Then under secondary causes, this is much broader. So we have diseases like diabetes, lupus, sarcoidosis, amyloidosis. Then we have infections like malaria, hepatitis, HIV. Then cancers like lymphoma, leukemia. We also have allergies. So even from insect bite or pollen. And lastly, we have drugs like the NSAIDs, the non-steroidal anti-inflammatory drugs. We have also steroids if they are used improperly. So it is really important to identify the root cause before treatment. Now, let's get into what happens inside the body. The key issue is heavy protein loss in the urine. Imagine your kidneys as coffee filters. Normally they let through the water and waste, but keep the coffee grounds, which is the proteins and blood cells in this case, they are kept inside. But in nephrotic syndrome, the filter is damaged and starts leaking protein out. That leads to low protein in the blood, and that's what causes the swelling. The body tries to fix this by holding onto salt and water, but that just makes the swelling worse. And with less protein in the blood, cholesterol goes up too. It's a whole chain reaction. Let's talk about how this shows up. The first symptom is edema, swelling around the eyes in the morning and legs or ankles by evening. But there is more. There's severe swelling all over the body, blood in urine, little urine output, tiredness, irritability, loss of appetite, fever, infections, especially peritonitis, breathing problems if fluid collects in the belly or chest. And interestingly, many kids with this condition have a history of allergies. So to find out if someone has nephrotic syndrome, we do run some kid tests. We do some urine tests, blood tests, creatinine tests, biopsy, and ultrasound. So for the urine test, we're checking for protein and blood. Then for the blood test, we're looking for low levels of albumin and high cholesterol levels. Then for the creatinine test, we just want to check the kidney function. A biopsy sometimes is needed to check the exact kidney damage. Then an ultrasound is going to show the kidney size or the swelling. So all these help us figure out both the cause and the severity. Treatment is all about protecting kidney function and reducing symptoms. Steroids are the main treatment, usually prednisolone. This helps to stop protein loss. A common starting dose is 2 milligrams per kg per day for several weeks. Then we slowly taper down over time. 8 weeks daily, then alternate day doses in decreasing amounts, and finally stop. We also use diuretics like furosemide to reduce swelling. ACE inhibitors like enalapril for high blood pressure. Immunosuppressants like cyclophosphamide in resistant cases. And we watch closely for infections because steroid therapy lowers immunity. If you are a nurse or caregiver, here's what matters: the environment. So the environment should be clean, infection-free, and also use reverse isolation. Position also important. Make sure that the patient is in an upright position with legs elevated to ease swelling and breathing. Observations: make sure that you check the weight daily, you do vital signs, you check the urine output, and also observe the mental state of your client. Under nutrition, make sure that whatever nutrition or diet the patient is on should have high protein and low salt. Psychological support should also be given to your client. So make sure that you explain the condition, reassure the patient, especially about their appearance. Okay. Hygiene also important. Help with bathing, oral care, nail trimming. Medication. So you should give the medications as prescribed and also watch for side effects. Also exercises. So the patient can do breathing exercises, position changes, and also walking to prevent sores. Okay, so let's now discuss patient education and also some of the complications that come about. So what do we teach patients? We need to teach the patients that they should take all meds on time, eat protein-rich foods, and cut down on salt. Avoid infections, meaning they shouldn't go to crowded places when on steroids. Maintain hygiene and avoid injuries, okay, because the skin takes longer to heal. So complications, yes, they can happen. So what are those complications? We have acute kidney failure, pulmonary edema, high blood pressure, growth delays in kids, vitamin D deficiency, and even glomerular scarring if it is a long-term thing. That's why early diagnosis, consistent treatment, and regular monitoring are critical. And that's what I had for you on nephrotic syndrome. I hope this made it easier for you to understand. Whether you're studying for exams, working in healthcare, or just here to learn, this knowledge could help someone in real life. Let me know in the comments. Was anything new to you? Did this video help clear things up? Don't forget to like this video, subscribe for more, and share this with someone who might find it helpful. I'll see you in the next session. Until then, stay safe, Stay curious.